thanks everyone for joining this meeting. And I don't know, everybody knows about our T32 program. So currently, this T32 program is, we are on third years, finishing up third year. Oh yes, time flies. So the title is Training in Interventions to Improve Outcomes in Chronic Conditions. So we have a very broad theme for this T32. And we've been having a lot of, under that, a lot of exciting research topics studied by our pre-docs and postdocs. So annually, we have a set of time, such as this research roundtable, where pre-docs and postdocs can talk about their progress. And then we have a brief time for Q&A. So how this is gonna work today is we have a total of 6 presenters, and each presentation will last about 10 minutes, but hopefully less than 10 minutes, and 8 minutes, less than 8 minutes for presentation, and followed by very brief Q&A. So if you have any questions, you can use chat box, or we don't have many people here, so you can just jump in and use your, you can just ask questions at the end. So I was going to have Elizabeth Hillsborough go first, but I will have her at the end. So our 6 pre-docs, and the first one is, I know Mary Claire, you said you're nervous, but don't be. Since you're nervous, and I'm going to ask you to present first.
Well, I was going to ask you if I could present first, so that works out really well.
That's great. That's great. So Marie Claire, well, we have a lot of our own graduates at BSN, and Marie Claire is one of them. And she's been working with Dr. Drenna Waldrop. Oh, by the way, does everyone know who I am? I'm Min Young Song, and I'm a co-director of this T32 program, along with Dr. Sandy Dunbar. And we also have Associate Director, Dr. Becky Gary as well. Okay, so Mary Claire, why don't you go? And Jean will monitor time. Is that right, Jean?
That's correct. I'll come
okay, thank you.
After 8 minutes, and then let her know it's time.
Okay, so I timed myself, so hopefully this will work out as well. So let me go ahead and see. How do I do this? Share. Okay. Can everybody see the slides?
Yeah, we can see them.
Okay, perfect. Thank you. Hello, everybody. My name is Mary Claire Montillis. I'm a PhD student here at the School of Nursing. I'm between my first and second year of studies. Today, I will briefly speak to you about my research interests and why I believe it's an important topic. And before we start, I just want to say that I appreciate all the opportunities that the T32 award offers. It's been really good to me. So this is a general concept. The image represents my general area of interest for research study. It's a broad framework. And first, my population of interest is people living with HIV. So I'm primarily interested in the impact of the history of psychological trauma on symptom management, self-management, and health outcome. So I have to say that I am at the stage, at the phase where I am attempting to sort out these relationships. So just bear with me, this is a lot, but I will share with you what I know so far. The history of psychological trauma, that is defined here as psychological trauma from physical abuse, sexual abuse, emotional abuse. And trauma is known to cause some morphological changes to the brain structures, where some of the cognitive processing deficits include processing speed, working memory, executive function, and learning and language fluency, among other deficits. HIV is a neurodegenerative disease, and so people living with HIV will experience neurological impairments with fluctuating impairments. That is, the impairment will fluctuate, and so it's doesn't stay the same. And patients can complain of difficulty in concentrating, memory, and impaired executive function. And as the disease progresses, they can experience psychomotor slowing, depressive and other affective symptoms, irritability, and mild motor symptoms. People living with HIV also experience a high burden of physical symptoms from diagnosis in advanced disease and while on antiretroviral therapy. So these symptoms include fatigue and pain. So pain and other physical symptoms have been associated with poor drug adherence, viral load, rebound, poor quality of life, and distress. And so with that in mind, all of these elements can lead to poor health outcomes. I'm also interested in self-management, and I have to look into the literature, but for the moment, I have not done that yet. So I still have to look into the self-management literature and how that relates. Again, this is really a broad framework, and I am at the stage of sorting out these relationships in order to formulate my research question. And so why is this important? Well, with the effectiveness of the HIV treatment, people are living longer and they're aging. And so as of 2018, the CDC says that there's 51% of people living with HIV that are 50 years old and older. And this is despite the decline of new diagnoses in that same age bracket. So consequently, they develop additional conditions associated with HIV, with aging, and HIV therapy medication side effects. And some of the other conditions, situations that are related with agents is frailty, falls, and additional cognitive impairment. So my timeline, recently I attended the HIV and Aging Conference, and it was really motivating. I truly enjoyed it. And what was really touching is to listen to people living with HIV talking about their lived experience with HIV as the years went by. So that was really touching. Soon I will start a research assistant position for a study that my mentor is involved in. And it's called Super Smart, and it's a mobile health interventional study to improve medication adherence in people living with HIV. I want to take advantage of a few upcoming conferences and training and some opportunities to present posters. But the one that is the most forefront of my mind right now is the NINR F31 application submission in September. And that's it. Thank you.
Thanks, Mary Claire. Does anyone have questions? Okay, stop chewing your lunch and please ask a question.
This is Sandy. Mary Claire, this sounds like a great plan and a great way to proceed. Could you just speak to your ability to the feasibility of obtaining the desired sample size?
Okay, so a great question. Thank you so much, Dr. Dunbar. Actually, this I will be working. I will be doing a secondary, doing a secondary data study, and so I had Dr. Waljob has a series of data available that I will look through and decipher which one is more fitting for my interest in my research question.
And you might end up merging data from more than one data set.
That's a question I probably should ask. But that sounds like that's something that's possible.
All right. No, that won't be possible.
Yeah.
Sorry.
Thank you.
I'm
Thank
munching.
you.
Sorry, I just came back from taking Eddie to the doctor, so
Oh, goodness.
I joined late, so sorry. So yeah, there's some shared some potential sharing across data sets, but I don't think that it would work for this particular question. But we have the minimum number is about 115 for one study, and the other is about 700. So I think we can find a happy medium somewhere.
Good.
Okay, time to move to the next one.
Sorry.
Okay, thank you. Thanks, Mary Claire, and thanks, Jean, for keeping the time. So next presenter is Krista Irwin, and she's been working with Dr. Becky Gary.
Hi, everybody. Trying to get this loaded up here. Let's see. Okay, can everybody see my slides? They come through?
Yes, we can, Krista.
Great. Thanks, Daniel. I was going to try to time myself too. Okay, so my study is entitled Incremental Effects of Aerobic Exercise on Inflammation Among Older Persons with HIV. It is a secondary analysis of the FitBrain study from which I've been working for, I guess, since the pilot back when I was in nursing school and in the Bridges program. This project has really gifted me a lot of insight on, people living with HIV and their, what they go through, but also their successes. I've been really excited to get to know them and see their progress through the study. This is my team, Drenna and Melinda and Becky, of course, and Becky's my weekly mentor. Gosh, she's really keeping me on track. And I've also have Vincent Marconi on my team, who is an infectious disease. He's one of the docs at the Grady IDP clinic, and he's just been an amazing resource as well. Okay, so I'm a second year student. I forgot to mention that. And my study is examining whether aerobic exercise, and I'm measuring in steps and by heart rate intensity, has this incremental effect on specific biomarkers, TNF, CD14, IL-6, and HSCRP. And our intervention group that were walking, there were 76 of them, and we're comparing that different doses of the exercise to an attention control group who were doing stretching and flexibility exercise, and there are 39 of them. And I'm looking, the whole study was 12 months. I'm looking at a longitudinal effect of, from baseline 3 months to 6 months. Okay. These are the specific games, which I've kind of already talked about. So I'm looking at the change in inflammatory biomarkers, and I'm basically separating the kind of methodology of looking at heart rate intensity, low, moderate, and high, and comparing that those intensity levels and the control groups over time. And but I'm also going to look at a step counting measurement and see if there's a comparable measure of inflammatory biomarker change. Okay. My thought in this, the so what that I've come to realize is that people need a home-based program, something that they can do easily at home and without supervision, without the cost that's associated with going to a gym. And I'm hoping that we can show that this kind of exercise is, comparable to something that would, in other studies that they've done under, site-based, under, guidance and trainers, I'm hoping that we can show a comparable change in inflammatory biomarkers doing it this way, because, it is more cost effective. It is more real life. Okay. I wanted to kind of give you an overview of what I've been up to this year. I've submitted a couple of abstracts, one that was accepted to the American Heart Association, and I'll show you that in a minute, and 2 that were accepted to SNRS, one of which on processing speed actually made the top 10. And Drenna and I was invited to contribute a very small bit to a publication that was submitted recently to JANIC, and that was a big thrill to be on a working team like that. And I'm currently in the process of submitting an TL1 program award, and this is a certificate program for translational research, which I'm very interested in. And the F31 is planned to be submitted in a couple of weeks. Another thing that I was really interested, or what I'm really interested in, is breaking into the global health world. And so I entered this global health case competition, and our team won first place. If you want to know more about that, it was a really cool experience. They take people from all over the university and put us together. I'll talk to you about that later. And then the Field Scholars Program Award was just announced that we will be doing a project in Lesotho on capacity building and needs assessment. Okay, so a little bit about this is the poster that was accepted to SNRS that won the top 10. It was looking at, based on preliminary data, greater change in information processing speed. And these were our methods and demographics of this, like I said, abbreviated study. And our results did not show a big difference in this first 3-month period. I was talking without my notes. But associations were found in some coding scores and in Stroop scores. Overall, younger age and education greater than high school was associated with greater improvement in information processing speed, like shown here in Table 5. And that's, like I said, in variables in the first 3 months. This other, okay, I'm gonna try to talk fast. Exercise adherence, this was another poster that was accepted to the American Heart Association and SNRS. And we were, again, it was a preliminary data and looking at exercise adherence. And I'm proud to say our FitBrain participants were very adherent to their exercise program the first 3 months. They knocked it out of the park. 77.6% of them exercised at the where the CDC and the American Heart Association recommends 150 minutes a week, minutes per week. But ours really exceeded that, and they met their exercise prescription adherence at 59%, and that's really amazing. So proud of my peoples. These are a couple of publications. I mentioned the one that I did with Drenna, so a couple in progress here. That's time. Okay. And this is just talking about the Global Health Institute. I would like just another second to talk to you about another thing I'm involved with being a TA in the population health class. I'm putting together a toolkit for improving the healthcare for transgender peoples, and that's based on very personal experience I've had with my own son. And thank you for listening. Okay.
Thanks, Krista. Any questions?
Hi, Krista. I just had a quick question. Why you mentioned that you were doing a limited time frame for your dissertation study of just up to 6 months. I was just curious why you weren't looking at the data all the way up to the 12-month mark.
Because of we actually had great or low attrition in our study, but we see kind of a plateau of effect at about the 6-month mark, or at least that's hypothesized. I may end up looking over the whole 12 months. Of course, I'm going to take a peek at it, but I thought just based on the on data that's already out there and on previous studies, that the people's, especially that inflammation, caps out about and within a 6-month period.
Oh, great. Thank you.
Hey, Krista, this is Becky McElroy. I was wondering how your study compares to what Brittany did, Brittany Butts. Is it related at all to, is it a continuation of what she looked at?
No.
Not.
I don't think Brittany did HIV. Is that correct?
Oh no, but she's looking at just was she looking at exercise in people and inflammation? I wasn't sure.
She was looking at a different set of variables, Becky. This is Becky Gary.
Okay.
Okay. So sorry, time's up. We have to move on to our next presentation.
Good job, Krista.
Thank you.
Thanks, Krista. Okay. I mix up all the, the people in order. Okay. So next presenter will be Lori Dimisco. Lori, are you ready?
Okay.
Lori is another our Emory graduate. We have a lot of Emory graduates because they're wonderful. Lori has been working with Vicki Hertzberg, and she's interested in neurocritical care nursing, particularly in the area of a stroke and improving the health outcomes. Okay, Lori.
Sorry, 1 second. I'm trying to find the slideshow button. Here we go. Can y'all see my screen?
Yep.
Oh, that's Stephanie's. Special thanks to Stephanie for sending her so I can had an idea of how to set this up. Okay, 1 second. Okay, I'm so sorry about that. Good afternoon, everyone. My name is Lori Dimisco, and I am a first year working with Dr. Hertzberg. So today I'm going to talk to you kind of a quick overview of what I've done this semester so far in the program, and a little bit about my research interests, my progress thus far, and some goals that I hope to accomplish. Since I'm a first year, I don't have all of the lovely results that Krista has, but hopefully I'll get there soon. Oops, how do I go back? There we go. Okay, so just very briefly, some background information about myself. My first degree was in biomedical sciences. I didn't know what I wanted to do with that degree. I just knew I loved science. So I started working with one of my professors to study the effect of silver nanoparticles on chick embryo development. And that's when I fell in love with research. After graduation, I took a job as a biomedical engineer, and I moved to Boston to work in a lab that specialized in utilizing microfluidic devices for translational research. Here I use lab on the chip platform to study the migration patterns of the neutrophil white blood cell in burn patients to help predict sepsis. These studies required that I go to the hospital to collect samples, and that experience led to my interest in the clinical side of research. So I decided to transfer from the bench to the clinic and took a job as a clinical research coordinator in GI motility. This is where I was exposed to the role of the nurse scientist, and that's when I decided like that's what I want to do with my life. But first, I knew I needed to become a nurse. And that's how I ended up at Emory. I was in the AMSN program, and after completing the BSN portion, decided to spend a couple of years working bedside as a nurse in the neuro ICU here at UH. During this time, I became involved with the unit-based research committee and the neurosurgery and neurovascular research group. I loved being a bedside nurse, but knew that if I wanted to progress to a neuroscientist, I'd need to pursue a doctoral degree. And that's how I ended up back at Emory. Okay, so as a nurse on the unit, I was exposed to the devastating effects of stroke and decided I wanted to focus my research efforts on improving stroke outcomes, which I have learned is a very broad topic. So right now I'm working on narrowing it down. I'm specifically interested in a type of stroke called an aneurysmal subarachnoid hemorrhage. My grandpa actually passed away from this type of stroke long before I ever thought of becoming a neuro ICU nurse. But it wasn't until working on the unit that I really understood how little is known about the pathology of this disease and how much work there needs to be done to help improve these patients' long-term outcomes. Okay, so my potential research questions. So in terms of like my specific questions, I'm trying to figure out a way to merge my background as a bench scientist with the person-centered holistic approach of nursing. One way I'm thinking of doing this is via translational research. So in the neuroimmunology area, I'm interested in investigating the cellular and molecular triggers that lead to intracranial brain aneurysm formation and rupture, and seeing if there are any interventions or ways we can target and prevent these events from occurring. I'm thinking of applying the psychoneuroimmunological framework. Thank you, Dr. Kelly, for introducing me to this framework this week, to this question to explore the mind-body interaction and aneurysm formation. Some other ideas I'm floating around pertain to interventions during the acute care phase that would minimize the need for long-term surgical intervention as a result of the sequelae of aneurysmal subarachnoid hemorrhage. And of course, since Dr. Hertzberger is my advisor, I'm thinking about different ways we could use big data to tease out variables that may predict stroke outcomes. Okay. So progress and plans. So over the course of the past 2 semesters, I've become more acclimated to the lifestyle of a PhD student, which means my research topic has changed every day. I've attended several conferences, which were great opportunities for exposure, and I've continued working with the neurosurgery team at EUH to publish a paper, submit another, and I'm currently doing data analysis for a third. This summer, I'll be working on my F31 submission, a paper for the secondary data analysis I'm currently doing in my 741 big data class, and continuing to build my body of knowledge and hopefully sleeping. And I just wanted to say thank you and special thanks to my cohort and Dr. Hertzberg. And if anyone has any questions further than this, if I run out of time, feel free to email me. Thanks.
Thanks, Lori. You've been busy. Okay, any questions?
Hi, this is Lisa. Lori, great presentation. Have you made any connections with collaborators outside the School of Nursing if you're thinking of pursuing something more on the molecular level in a topical area that may not be have experts in the School of Nursing? Do you have people in your unit at the hospital, or I'm just wondering, trying to think through the translational science piece. And I know you're just kind of, your research question is changing every day, but I'm wondering if you thought about that.
Yes, I actually have the team that I work with at Emory currently. We just got funded for a grant to do this, to actually look at the immunology behind aneurysm. So writing the IRB and hopefully can start that pretty soon, but we're getting all the stuff to get the lab started. So yeah, I'm just trying to, I know that piece is going to move forward because I have the team here. I'm just trying to figure out how to like bring the nursing piece into it. So yes, to answer your question, I do have the support in place for that part, but I'm looking to meet more people over the summer.
Excellent. That's great.
Good. Any other questions? Okay, well, thanks, Lori. So we'll would like to hear more about your progress with the research questions, and hopefully you will land in specific questions soon, and then move forward. Okay, our next presenter is Stephanie Lee, and she's also our own graduate. And she's been working with Dr. Kate Yeager. She's interested in health literacy and symptom management in oncology patients. Okay, Stephanie.
Thank you. Can everybody hear me and see my slides?
Yes.
Okay, perfect. Thank you. Give me just a second to get this pulled up. And I'm sorry that I may not be looking in the camera. I've got a couple of different screens going here, and it helps me get it done. Okay, so again, I'm Stephanie. Nice to meet everybody. If I haven't met you already, my advisor and the lady that tells me everything that I know is Dr. Kate Yeager, and I'm so grateful to her for her help for the last several years of my life, and also this year and with this presentation. And thank you to the T32 program for this opportunity. So my background, I'm originally from Knoxville, Tennessee, and came down to Emory to do my BSN as a second degree. I graduated with that program in 2017, and then went to work at Winship as an oncology nurse, and actually did not work inpatient. I went straight to outpatient, which is a little bit of a different path, but it was the right path for me, and I learned a lot of different skills there. I also cared for different patients of all different kinds of cancer, medical oncology, hematology, bone marrow transplant patients. But I specifically worked with patients on phase 2 and phase 3 clinical trials. So I worked really hard to collect quality data and care for the patients that were actually on the receiving end of research. I was a preceptor on that unit. I was on the unit practice council, and I also sat on the larger Winship magnet committee, which we were trying to get Winship designated as a magnet center, which will be the first ambulatory center that will be magnet certified, hopefully. I also was in the Vizient program for nurse residency and had one of the top projects within my cohort when we graduated. So my weakness is that the fact that I don't have a lot of research experience. I started working with Kate before I applied for the PhD program just to kind of get my feet wet, but I really am starting from the very beginning. And so I'm glad that I've been given this opportunity. I do know that I want to study, keep my lane within oncology. I love what I do. I love being an oncology nurse. I was OCN certified last year, which really specializes my knowledge within oncology, but much more clinical knowledge than research knowledge. I'm particularly interested with rural populations. Again, being from a rural area, not just patients from that area, but patients from all rural areas. I really care for that. Within rural populations, my kind of where I'm trying to aim down my interest is for treatment adherence, and treatment adherence can mean a variety of different things. Currently, which I'll go into the next slide, my mode of treatment adherence is with oral anti-cancer agents and how patients take those kinds of medicines. And that idea kind of came from Kate's study that I've been working on, which I will detail later as well. I'm also interested in this idea of health literacy and how health literacy changes how people take their medicines, specifically within the rural population. So we know a lot that people from rural populations do not have that great of health literacy. And we know that health literacy, poor health literacy leads to poor treatment adherence, but we do not know how specifically that works with rural populations taking oral anti-cancer agents. So that's kind of where I'm headed and have been working on this semester. Other interests include working with clinical trial populations. And if anybody would like to know more about what that looks like for oncology patients, please just ask me. I probably don't have time to go into all the details here, but it's a very specialized, very niche kind of area, and it's the best. So Emory has so many great opportunities working with clinical trial patients in oncology that I would love to tell you more about that. I'm interested in symptom management and palliative care, especially for patients that are on clinical trial. So these are my potential research questions. The first one is the one that I have fleshed out the most, especially within class this semester and in my reading about the different areas. And that is, what is the relationship of health literacy and oral anti-cancer medication adherence and rural adult cancer patients? So just as a side note, there are different kinds of anti-cancer medications that people can take by mouth. And that can include hormone therapy, targeted therapy, and actual chemotherapy. So it's a wide variety of different things. And cancer treatment is moving towards this way. So a lot of people will be, managing by themselves, and that's really important. So that way the patients know how to take their medicine and what to do. As kind of a sub question about that would be how providers perceive how patients take their medication and what actually happens when patients take their medication. I'm interested in that, and maybe even if there's a difference between community oncology centers and academic medical centers. If I can tie in that rural piece, that would be great. Some of my more not fully developed questions would be how treatment adherence compares between patients who are maybe really early stage within their cancer diagnosis or patients who are more late stage. Think about it like a chronic disease. So an example would be myeloma, which is like a bone cancer, but patients survive, have really, really good prognosis, and they survive for a really long time if they take their medications, and it's very manageable, or like chronic myeloid leukemia. So how those patients take their medication versus somebody who is pretty early on in their diagnosis and in their disease. And then my complete wildcard question would be the transition in care for patients coming off of a phase 1 clinical trial, and just a little bit about what it means to be on a phase 1 clinical trial. So there are different phases, right? And from 1 to 4, 4th is when the drug is out and being used and is FDA approved, and they're collecting data on it after it's already out in the general public. A phase 1 trial is the first time that this drug has been tried in a human, and the patients that are put on these trials are often not doing it for their own benefit, though there is hope that it does benefit them. They are doing it for the betterment of humanity, let's just say. But with that, they're really looking at the dose of the medication and how the medication works in somebody's body and how somebody's body affects the medication. So the pharmacokinetics and the pharmacodynamics. But if the patient cannot tolerate this treatment or they progress in their disease, they have to transition off of the trial. And what happens with that? What happens after they've kind of already, they're at the end of the road? What happens then? And who takes care of that patient? And how do they feel about it? So that's a really good idea that I had from one of the conferences that I actually went to earlier this semester. So that was from the NIR NCI Symptom Science and Advances in Oncology Nursing. That's where I got that idea, from one of the presentations that I saw there. I've also attended SNRS, and I'm also with Kate kind of dabbling around with this Cancer Prevention and Control Research Network, which is from the CDC, and they have different hubs around the country. One of actually is which is based at Emory, and they really are able to get groups together to do different kinds of research projects and connect and impact the different cancer control that we can have. So that's a really good larger networking opportunity that I have, and from that I'm able to work with a rural populations specific interest research group. Okay, thanks, Jean. So I'm also working with Kate in her study, but we can go into that if you'd like to know any more details. But I've learned a lot working with her and being a research assistant with her and learning the difference between being a nurse and being a researcher. I'm going to submit my F31 within the next year, and I have lots of plans to get my life together this summer and try to figure out my topic and start working on my F31. I'm happy to answer any questions that you may have. Sorry that I had to wrap it up so quick. And just let me know.
Okay,
Thanks.
thanks, Stephanie. Questions, please.
Hi, Stephanie. Could you speak a little bit more about what the literature might say about rural communities and oral cancer adherence? Is there evidence that there is an issue with that, or are you just sort of from your own experience hypothesizing that might be an issue? What sort of can you say about that? I was just wondering.
Thanks, Carolina. So what we do know is that rural cancer patients have poor health literacy. And we know that poor health literacy leads to poor adherence. What the connection that you're talking about, do patients from rural areas have poor medication adherence, is kind of what I'm not seeing a lot about in the literature and what I'm trying to get at. So that's actually kind of my research question. Does that help?
Great.
Sorry, yes, yeah, that helps.
Thank you.
Thank you. Thank you. So with the interest of time, we'll have to move on. Well, thanks, Stephanie. Okay, our next presenter is Megan Mayfield. She's our one of the new T32 pre-docs, and she's not from Emory. She did a master's degree at Clemson University. Is that right, Megan?
That's correct. Yes.
Yes. So I'm very glad you are here. And Megan is also working with Becky Gary, and she's interested in heart failure, also palliative care, as if I remember correctly. Okay, Megan.
Thank you so much. I'm going to share my screen. Move this bar at the top so I can get to the slideshow. There we go. Are you all able to see my screen?
Yes.
Yes.
Okay, well, good afternoon. My name is Megan Mayfield, and I'm a first-year student in the PhD in nursing program. I have the privilege of learning from and working alongside Dr. Rebecca Gary, and I would like to thank the T32 program for this wonderful opportunity. So to provide a brief background, I graduated from Clemson University in 2013 with a BS in nursing, and then in 2018 with an MS in nursing with a focus in nursing education. I have been a registered nurse for 6.5 years, the first 5 of which were spent on a progressive coronary care unit at Spartanburg Medical Center in Spartanburg, South Carolina. Currently, I work PRN in the cardiopulmonary lab at Spartanburg Medical Center, as well as Pelham Medical Center, which is in Greer, South Carolina. And I assist with cardiac stress testing, transesophageal echocardiograms, cardiac event monitor placement, and our heart failure clinic. While I was on the progressive coronary care unit, I served as the unit governance committee chair, and I also precepted undergraduate nursing students and newly hired nurses. Prior to my time at Emory University, I was a lecturer at Clemson University School of Nursing for 2 years, and I worked primarily in the medical surgical courses. For Medical Surgical 1, I was a co-lecturer, and I also served as simulation and clinical faculty, and then I was lead faculty for Medical Surgical 2. I am a certified nurse educator through the National League for Nursing, and I'm also certified in BLS and ACLS. My research interests include heart failure, caregiver burden, barriers to health services, and outpatient symptom management. Aside from my clinical experience, the driving force behind my passion for cardiovascular nursing research stems from a strong personal connection to cardiovascular disease, as I lost my grandfather to heart failure in 2017 and my father to myocardial infarction in 2018. Currently, my research question, which I fully plan to fine-tune this summer, is what is the relationship between caregiver burden and cardiovascular disease risk in rural family caregivers of patients diagnosed with advanced heart failure? And the aims are to examine the relationship between caregiver burden and cardiovascular risk in rural family caregivers of patients diagnosed with advanced heart failure, to determine the specific barriers to health services that directly impact rural family caregivers of patients diagnosed with advanced heart failure, and to evaluate the influence of barriers to health services on the relationship between caregiver burden and CVD risk in rural family caregivers of patients diagnosed with advanced heart failure. In Dr. Kelly's course this semester, we have been working on conceptual frameworks for our research, and this is a current version of my framework. The inspiration is from Dr. Hans Selye's general adaptation syndrome, which includes 3 stages: alarm, resistance, and exhaustion. So on the left, I've included multiple factors such as rurality, the overwhelming nature of caregiving responsibilities, existing health issues, lack of proper education and training, and demographics, which can all lead to caregiver burden. And also I've provided bidirectional areas to fatigue and stress, which are also directly impacted. And what I want to do through my research is examine how all of these factors contributing to caregiver burden can potentially lead to cardiovascular disease risk. And I plan to evaluate using the Life Simple 7 tool from the American Heart Association. All right, so last August, I had a publication in American Nurse Journal with a wonderful colleague at Clemson, Dr. Tracy Fasolino, and I recently had a manuscript accepted for publication with a team from Clemson University and Prisma Health, which will be published in International Journal of Human Caring next spring. For the next academic year, I'm planning to prepare and submit abstracts to present at American Heart Association scientific sessions and SNRS. Additionally, this summer, I will be preparing a secondary data analysis that I'm currently working on in my big data course at Dr. Higgins' Nursing 741 course, and I'll be working on that this summer to prepare for submission as well. I will also be planning to finalize my dissertation committee, as I've been working remotely this year from South Carolina due to the pandemic. I really am looking forward to establishing relationships and really seeking out that committee this upcoming year. I'm planning to start working on my F31 this summer with hopes of submitting in spring of 2022, and would also like to start preparing my dissertation proposal as well. I've provided my email address up top if anyone has any questions, and if anyone has any questions right now, I'm free to answer those. But thank you so much for your time and for the opportunity to present.
Thanks, Megan. Great presentation. Sounds like you are moving forward pretty fast. That's great. So your dissertation, you're planning to involve a primary data collection?
I am. Right now I'm working on a secondary data analysis, but I would like to do some primary data collection for a piece of it as well. Looking at working with caregivers in a rural outpatient setting, trying to figure out what the ideal sample size would be for that, especially with my first experience with collecting primary data. So yes, planning on it, but we will see.
Okay, great. Any other questions?
Hi, Megan, this is Sandy. Great presentation, and definitely an important and significant topic to study. One of the questions I have for you, and this is back to your framework, which is interesting, and definitely I think very much supported by the literature for each of those components. I also think about another big aspect of that, and that is social support. So I didn't see anything like other types of support or environmental resources in your model, and just wondered what your thoughts are on that.
I think that's definitely, thank you, Dr. Dunbar. I think that's definitely an important component. And over the summer, I'm planning to really delve into the literature a lot more to really fine tune that framework. So that is something I will definitely look at as social support. I think it's very important, especially for the framework. And I definitely appreciate the suggestion. Thank you so much.
Great. Okay, so we have one more presentation. Thanks, Megan.
Thank you.
Long wait, Elizabeth of Hillsborough. She may not be able to show her slides due to internet connection problems. Elizabeth, are you here?
My internet's also out in my neighborhood until 5 p.m. So there may be some local outages.
Same here. I had to run
I
to the
see.
PhD room.
Yeah, I see Elizabeth here. Hey, Elizabeth, can you hear me?
She said she's having microphone issues.
Unmute your mic, Elizabeth.
Yeah, her mic is on mute. Okay, while we are waiting, we have only 8 minutes.
Can you
Okay.
hear me?
Yes.
Okay, I'm so sorry about that. Such technical difficulties today. So I'm going to turn on my camera so at least you can see me.
There you are.
Hi.
Hi. Okay,
So
go ahead.
we're making it work. Okay.
Mhm.
So my name is Elizabeth Hillsborough. I am in my 4th year of the doctoral program. Hi, Dr. Kelly. Great to be seen. So I recently entered candidacy in December of last year. It was a long time coming. It really took me about 2 to 3 years to develop my dissertation proposal, and it's gone through many iterations. Came to the program interested in doing palliative care and end-of-life research, but for the last several years, I found myself in the dementia and dementia caregiving space, and it's been extremely rewarding. So like many of you, I've had a few twists and turns in my journey with nursing. So my first degree was in psychology, and then I came to Emory for the AMSN program. But a few semesters in, I decided to pursue my PhD. So there have been a lot of things happening at this time. I'm currently in my 2nd semester of the APRN program, and I'm pursuing a license in adult gerontology primary care. So the focus of my dissertation is on adolescents who have parents with young onset dementia. There is very little literature on this topic. When I first started delving into it, I pulled 76 articles, and of those 76 articles, only 45 were really relevant to my area of interest. And of those 45, only 16 were actually on the subject of children and adolescents who were living in homes with a parent with young onset dementia. And of those 16, only 4 are published in the US. So there's still a lot of work left to be done. The reason why I became interested in this topic in the first place was because I was really fascinated by all of the challenges that these families face on their way to receiving a diagnosis. So Alzheimer's disease is the subtype of dementia that we arguably know the most about, that the most research dollars goes towards. But there are other types of dementia that occur more frequently in younger individuals, such as frontotemporal dementia and even Lewy body dementia. And so dementia being defined as symptom onset before the age of 65, you can understand that a lot of these families are receiving such a life-altering diagnosis at a time in their lives when they least expect it. And this has downstream effects on the children. So overall, some of my biggest research questions that I hope to answer are going to be understanding the overall experiences of adolescents who are living in this situation, and more specifically, understanding their caregiving experiences, as this has not been well defined in the literature, and many of them, youth caregivers in general, also don't necessarily define themselves as caregivers. And so taking all these pieces together, what I also hope to answer is how does the situation affect their identity development? So the last few years have been a process of not only familiarizing myself with the existing literature, but also trying to hone my qualitative skills. So Dr. Kate Yeager is on my committee as my qualitative expert, and she has been absolutely invaluable in helping me understand some of these pieces. So I will be doing the primary data collection, a qualitative study of about 15 to 25 adolescents who are between the ages of 13 and 19. One of the interesting things in building my proposal was understanding the concept of consent and informed assent. And there's a pretty extensive literature out there, but the approach that I will be taking for my particular study when recruiting and enrolling participants, given that a lot of them will be minors, is taking a family meeting approach. So trying to find that sweet spot between honoring the relationship between the adolescent and their parent in determining their involvement in research, but then also helping to support the adolescent's own autonomy and independence. So that is a really brief overview of the work that I'm doing for my dissertation. Next steps for me are to submit my F31 this August, to also continue putting together my IRB application. And then come January of 2022, I'll be full throttle on my dissertation, starting with recruitment and data collection. So for the remainder of this year, I'm wearing a lot of different hats, being in the APRN program. But one thing that I'm really excited about is this summer I do have a rotation in general neurology. So seeing patients is something that is very important to me in my career long term. And what I hope will be the case is to be able to do research and practice in the same setting. I have definitely fallen in love with cognitive neurology, movement disorders. So doing research in a clinical capacity is something that I'm very interested in. So hopefully I was able to give a really good overview of where I'm at, but I look forward to any questions that you may have. And thank you to all of you who have provided me support over the last several years in getting to this point.
Thanks, Elizabeth. Any questions?
I have a question. Elizabeth, how do you plan to recruit patients, and like from where would you get them, especially with them being minors?
Yeah, that's a really good question. So my two primary recruitment channels are support groups that I will be accessing through leading organizations. So Alzheimer's Association, Association for Frontotemporal Lobar Degeneration, things of that sort. Also research centers. So for example, the Alzheimer's Disease Research Center, which we have here at Emory. And then another contact that we have is Northwestern University. They have a pretty large repository of patients with FTD. So that's a really great question that you had about how I'll be recruiting adolescents. So the challenge and also kind of the excitement of getting this experience is I will have to recruit them through their parents. So not only are there very few resources for families with young onset, but there are probably none right now for adolescents specifically. So my hope is that I'll be able to identify potential adolescents through their parents who are involved in support groups, who are taking their loved ones to appointments, and building those relationships with clinicians and researchers who have access to this population. So it's definitely going to be an iterative process, but yes, I will be accessing the adolescents through the parents.
Thank you. Well, we have, I think it's 1 o'clock right now. And again, Elizabeth, I'm glad that you were able to join and present your progress. And thank you, everyone. I think everyone did a wonderful job, and I have a much better idea where you are. And particularly, I'm so glad to learn that everyone is working on F31. So great job, everyone, and keep the good work. And thanks, everyone.
Thank you for letting me go first.